This conference will now be recorded.
Okay, so we are live recording now. So again, thank you all for coming this morning, and welcome to the Chamber's Community Conversations. Our first guest in this series is the City of Gadsden Fire Chief, Stephen Carroll. So Chief, thank you so much for taking the time this morning to join us and participate in this with us. We appreciate you and everything that you and the fire department and all the frontline workers are doing right now with all this uncertainty and all these changes. Chief Carroll, we talked about some of the tips for businesses reopening, some of the response challenges that the department has faced recently and how they've overcome them, and how the business community can help with that too. So with no further ado, I will turn it over to Chief Carroll to say a few words and do a quick introduction. Chief, you want to take it away?
I appreciate it, Will. I appreciate the support of all the community and everything. It's been overwhelming about the community's love for the fire service and for all emergency responders and healthcare workers over this last couple of months. We're probably within our first 53rd or 4th day that we started monitoring the COVID-19 pandemic and how we were intended on responding to it up front. We learn something new about it every day. And before I get too far, I want to brag on my department. I can't, in my career, they always told me that never miss an opportunity to brag on your department. And I want to brag on mine because they have took this new protocols we put in place in stride and have done an excellent job of delivering a professional service with a modified delivery system that we've given them out there in the field. So I want to brag on them, and I appreciate everything they've done during this period of time. COVID-19 provided a lot of things different for us in the fire service. Now, we do EMS services. We're the emergency response providers for the City of Gadsden. We're the primary response provider. We have 2 ambulance services that are assigned, an ambulance is assigned to the fire department for transports. But the fire department is your primary provider of EMS inside the city limits. So we had protocols in place for nearly all types of EMS calls, but the COVID-19, because of the contagion being so contagious and the different things that it presented to us, we had to start modifying our type of responses to those incidents. So early in the event, actually, we got way ahead of the event in comparison to the other cities in the state of Alabama to try to get ahead of that, set protocols, set restrictions for our department members. We wanted to do our social distancing within inside the department, so we didn't allow engine companies to travel to other stations to pick up supplies or whatever. And going to the store was only 1 time a day. You couldn't go twice a day to get you had to do a lot more planning involved in that. And they was pretty much isolated for their stations, except to make emergency calls as they was presented with. But it also presented us with some issues about personal protective equipment. The main issues that we as an EMS provider had a certain amount of this same type of equipment. In fact, I probably did a news brief with one of the news reporters, and one of the questions was asked, "Well, how much PPE do you have? Do you have plenty PPE to handle this issue?" Now, understand my answer was based on what I knew back 3 months ago or 2.5 months ago for this event. And I told them that we probably had enough PPE to handle the event, and we probably would not be in need of PPE. I digress at this particular point in time. Since it's 50-something days into the event, we went through our supplies about 2 or 3 weeks into the event, and we, like everyone else, were scrambling for personal protective equipment. The problem was everybody was looking for the same type of equipment, so that supply quickly diminished and put some EMS services in a strain. We were fortunate enough to be able to get with some of our suppliers and get that personal protective equipment a little bit at a time. We're still hurting. Do we have enough to handle the entire event? I don't know how long the event will last, so I'm gonna say no. We have enough probably last us for another couple of weeks or so, and we're constantly trying to acquire that personal protective equipment. But I don't want to ramble too far, get too far out there with this, what we do, but we changed our protocols on our emergency responses. There were some calls that we just did not make, and we let the ambulance take care of them by themselves to try to limit the exposure to our personnel and also to conserve the personal protective equipment that we were having to don every time we went on an emergency call. Those type of calls were like doctor's office calls. They tend up being more like a transfer from the doctor's office to the hospital and not an emergency medical call for us at that particular point in time. If it was, we made the call, but we didn't necessarily go in until we found out exactly what the situation was in the doctor's offices. The same thing when we make a call to a personal residence, we let one individual get their personal protective equipment on and go in and assess the patient, and then they determine how many additional personnel they need to come in order to limit the exposures and also limit the amount of PPE we would have to use on a per call basis. We found out early in the event, because in our dispatch areas, they were asking specific questions to each one of the 911 callers about if they had shortness of breath, if they were had a cough, or they have a fever, and those kind of things. We put those things in their protocols of asking when the 911 call came in. Unfortunately, all of our callers weren't up front with their symptoms, so we discovered initially that just because they answered a negative to it did not necessarily mean that they weren't presenting the signs and symptoms of a COVID patient. So we had to modify our protocols again and state on every EMS call, whether it be an accident, motor vehicle accident, or anything else, one person approached the patient to determine what the condition of that patient is before all of them gets their PPE on and approach those patients. So we had to do a little bit, and I'm gonna catch my breath. So if you got any questions, I'll be glad to answer those.
I don't see any questions in the chat box yet. If you have questions, make sure you pop them in there. I'll start the ball rolling with one. Chief, do you have any safety tips for businesses during all of the reopening, as far as, you know, some things to help them out, or things that can help you guys out as a department?
Well, there's a lot of things that, and most of it's pretty much been talked about in the past. You know, the social distancing tends to be the primary deterrent to, you know, contracting this particular strain of COVID. So we want to make sure that we keep our social distancing no matter what, whether it be in a restaurant and everything. It's awfully easy when you go back to doing the norms to go back and to start doing the same things you always have done. And it takes an additional thinking pattern to change to make that process go to the new norm. About, no, you don't necessarily want to go up and hug people or shake their hands or different things like that. And you always want to keep your hands washed and clean and sanitized no matter what. The use of masks has been a little bit slow in some areas and more prominent in other areas about whether you use masks, don't use masks. The issue about mask is not necessarily that it's going to prevent you from getting the disease. It may keep you from giving someone else the disease if you have it. That's the biggest thing about masks. So masks are when you're going out in a crowd or into an environment, I think some of those times they are really needed. Other times they're probably not needed when you're outside, just and you got a limited number of personnel around you all the time. You can keep that social distancing. I don't. But again, that's something they still are contemplating across the country and the world about the use of masks and not the use of masks. But I know a lot of restaurants. I've been to a few since the opening has been here and seen how they were handling. Some of them are doing an excellent job with it. I think the biggest issue I think we need to continue to watch out is those how the patrons come up to the restaurant from the outside and come through a door, especially if you got a limited space in front. When you come inside, they tend to pile up because everybody wants to get their name on the list. Maybe to have someone that's standing outside with a mask, gloves on, whatever, and let them space out a little bit further outside so they don't have to come inside the doors and everything. That's the biggest thing I've seen so far that could possibly, because they're inside their space and their tables and different things. It looks like they're doing an excellent job inside there.
Okay. We got a question, looks like, from Leslie Bishop. She said, I have read that there has been a pushback from groups on reporting the addresses and names of those with COVID-19 positive tests. Can you explain why this is so important to first responders so we can explain this to these groups?
One of the things that's important for us as first responders is we always want to know about what situation we are getting into. We're going to do the same protocol whether we go to any particular address, but we are given as a fire service addresses of COVID confirmed cases within the city limits. That just gives us a little bit more time to get prepared about what we're going to have to do and how to go about doing it when we get there. Take a little more caution. That makes your thinking pattern get back in place about not doing the things that you normally do. We had a couple of individuals that did an excellent job on the entries, and when they came back out about what they did during their decom process, made us put them in quarantine because we wanted our guys to understand that we're serious about keeping you safe. And that's why we need to know those addresses. Just puts our guys in a little bit different thinking pattern. Not that we're not going to go inside and give professional service, because we're going to do that no matter what the patient's conditions are. But we gives them in a little bit different thinking pattern to not take that glove and wipe their forehead when they're sweating or something like that. You know, we've got a situation here that we want to make sure that we do our due caution and extreme caution with. We try to do that on every case, but once you make as many calls as we make EMS wise, some of that old habits start trickling in with the new, and we need to make sure that we keep our line of thinking toward what we're doing and dealing with today, and not what we used to deal with 2 or 3, 4, 5, 6 weeks ago.
Yeah, you're correct. I mean,
and that came from Leslie. That's one of my firefighter wives. I don't know.
Well, you're correct. I mean, the more you guys know and the more you're prepared ahead of the situation, the safer that your department can be, and the better you are to respond to that. Leslie says, thank you for all you do in your department, Chief Carroll. So she said thank you. I can personally vouch for all the calls that you do from the chamber office. We're always hearing the fire trucks and the ambulances go by our office in downtown.
It's amazing. We typically, on average, make 80 to 90 EMS calls a week.
Wow.
We average probably 170, 180 calls a week total call volume. That's not from one station. I've got 8 different stations across the city. Just so happen station 1 right here at Central is one of the busiest stations we have. We have station 9 and 4 also makes a good many calls, East Gadsden and out toward Alabama City. The other calls, other stations may not make as much call volume, but their call volume is pretty high also. But the EMS calls during this period, one of the things have monitored during this entire period is our call volume, how our call volume is in relation to the what we call COVID-19 patients or those that come in with those types of symptoms are called PUIs, person under investigation. We monitor that to see if our trend and our curve is running in correlation to the confirmed cases within the city, and we found that it is, and so we can correlate those things to determine if we're making a difference or how this disease is actually going on in the city. Now understand that some of the confirmed cases are just because of additional testing that we've had in the community. When this thing started, we probably had less than 1% of the county's population tested. Now I think we're up something, I'm not know exactly, 5 or 6% of the county's population tested. So you're gonna have more numbers, but it don't mean that you had more cases. They were always there, you just confirmed that they were cases. But it's important for us, again, that we know that those patients are there, just for the mindset again, and our guys is going to do a professional service for each patient and treat them with the same type of care that we would be if it was our child laying there with any type of disease. We're going to treat them the same way.
We've got a question from Shelley Hester with Etowah Pediatrics. Is there anything you want medical offices to know? Anything they can do to help your efforts?
Well, what we need to know a lot of times, and we typically don't go to the pediatrics that much, but we do have a lot of doctors' offices that have patients that come in and they need to go to the hospital, like I said before. And again, if you call 911, no matter if you call 911 for an ambulance or whatever, you're going to get Gadsden Fire because we're the primary providers of EMS in the city. But if you could explain to those on 911 that this is more of a transfer, not a medical call, then we can limit the exposure, because you may have a COVID patient in your office, and that's one of the first things we're going to try to determine if this is a patient that is exhibiting signs of COVID, whether they're confirmed or not. So if we can know that up front, then we'll limit the number of exposures coming into your office, because we're going to come up, knock on your door first, and if we don't know up front, and let you tell us what kind of situation you have before we actually let our personnel come in to those situations. So if they can give us any of that, primarily just help educate everybody along the same lines about keeping social distancing and different things like that within their staff and everything. Not minimize the seriousness of this event, but we want to make sure that everybody is staying very conservative and cautious with this event.
Shelley says thumbs up, so it's okay. Do you have any other questions? Anyone, if anyone wants to unmute themselves, ask a question, you're welcome to do so as well. Well, I don't see any more questions. I'll ask another one myself. We can just keep the conversation going. So is there anything aside from medical practice offices, or is there anything that the business community can do for you guys as far as helping supplies or anything like that it can help out?
Well, certainly, and I want to brag on our community. I think I said that a little bit a while ago, but the business community has been overwhelming. I mean, my biggest concern after this is to try to get them back exercise, and we don't exercise every day like we typically have. We cut out going to the gym and everything. Was one of those things that we had to do, cut out our training and everything, so we didn't get multiple people together at one location and stuff like that. But now we got everybody in this world bringing us food and we're eating well, and we appreciate that, and I know the guys appreciate that greatly, and everything. So we've had a lot of support. We've had people coming and offering us PPE. Some of it's not the medical grade PPE that we use, but we can certainly use it for other things and cleaning up around stations and stuff like that, so we can conserve our medical supplies for what its intended use is. So we appreciate all the support that the community's given us and everything, and we hope you help us support those that's been helping us too, in that you know, the hospital staff and everything. I told Heather earlier that today and tomorrow we will be having some hospital staff appreciations, and by lining up in front of the hospitals this evening. So you see a bunch of fire trucks, police cars around the 2 hospitals today and tomorrow evening. That's because we're there just to show our appreciation for the hospital staff, because all the patients we see in the field end up being at one of those 2 hospitals more than likely. So they take on our patients. So we appreciate all they do.
That's a fantastic program that you guys are going to be working on the next couple of days. Can't wait to see how that goes. I think I saw Dixon Hayes unmute himself. Dixon, do you have a question?
I do. Chief, have there been any new protocols you've adopted in the COVID-19 era that you think will be a permanent part of the fire service going forward?
Dixon, yes, we've discussed that within our department already, that the use of PPE is going to be changed a little bit. The protocol that we're using now about one person going in and assessing the patient before we allow any others come in, especially depending on whether they have to be in full protective gear or not, is going to change. In the past, you know, depending on the type of call, diabetic call or whatever, we typically did not necessarily put on a mask or gloves. We always put on gloves, but I mean, in that ensemble of PPE, we wouldn't normally do that, but we will be doing that in the future because we never know what we might be confronted with. We want to limit that exposure to them and to our personnel.
Thank you, Chief.
Yeah, there's several protocols that we're going to be changing in the future and how we go about doing business on a day-to-day basis. That'll be our new norm versus what we used to do.
Thank you very much, Chief.
Thank you, Dixon.
Yeah, and you're right, Chief. It's going to take a lot of adjusting, continual adjustments to find the new sense of, you know, quote unquote normal as we're calling it. A lot of different things changing. Do you have any other questions in the chat box? I don't see any there. Any more questions? If I want to unmute themselves, ask questions.
We've applied. I'll say this: we've applied for numerous grants during this time for extra PPE, and we're also fortunate through the community grant program through the city. We actually were able to acquire some pieces of equipment I think is going to be beneficial for future cases. It's things we start looking at. Maybe we were a little lax on or did not have certain types of equipment that in the future we'll have plenty of those, or have maybe not plenty, but have some of those readily available to us. Some of the things like fogging machines for deconning large spaces and different things like that. Doing the fever detection. We're going to be looking at some mass fever detection like they use in airports, to where you can set it up in large crowds. It'll pick out someone with a fever. Instead of having to go up, stick a thermometer up to each and everybody's face, you can actually pull those people out to the side and check their temperature, but you don't have to pull the whole crowd out. We're looking at some fortunate to get some digital laryngoscopes. That probably don't mean much to most of you. Those in the medical community out there knows what I'm talking about. But one of the primary life-saving events that we do in the field is intubation of the patient, actually getting a tube down in the trachea so we can open that airway up and get good airflow and oxygen transition through that tube. The Alabama Department of Public Health stopped letting us use our normal laryngoscope simply because the responder had to get down so close to the face to actually see those voice box and everything, and be able to get the tube down the right, not go down the esophagus, but go down the trachea. So they stopped us from being able to do that. And the only way we could do that if we had digital laryngoscopes, which lets the paramedic get back a little bit further from from the patient. You've got a camera that's showing you how to get where the tube's going and everything. So we were able to get some of those through that grant. And also there's a device called a Lucas device that we're going to get. We have two in the department right now. They are automatic CPR machines, pretty much, to make it simple about what we're talking about. They do compressions and different things. We've had great results out of those machines, and to the point that when we get to the hospital with them, doctors don't want to give them back real fast. They want to keep them on them until they get a little bit some things done inside the emergency room when we get there. So we're able to acquire two additional more of those. So that'll give us 4 inside the city, and those are not cheap items. Those are pretty expensive items, and that we were not able to purchase any in our regular budgets. So we were very fortunate to get some of that through some of the grant funding and different things. So grants have changed a little bit here recently. They've started dropping some of their matching funds that the cities have to provide. So we're looking at some of those. So most of these now are turning into 100% grants instead of any match from the local. And they're all federal grants, most of the ones I'm seeing and being able to apply for. So the whole world is sort of changing and trying to help out the locals and especially the first responders and the hospital staff members.
We got a question from Heather New. So there are efforts to prepare for potential resurgence of the disease in the fall. Some say the curve may look more like a W than an arch. Do you have any advice for the community to prepare for this, if this is the case?
Well, one of the things we've got to do is be cognizant of that could very well have another wave, just like flu does every year, coming back when it's cooler weather and coming back. We have to be cognizant of that fact all the time. We are in the department are trying to get enough PPE over the summer months to try and stockpile a little bit more for the fall, simply because we don't want to be caught like we were at the beginning of this one and just have 1 month supply or a couple of weeks of supply. We want to have enough supply of hand sanitizer and all those type things that everybody went off the store shelves. We want to try and keep some of that ready for the fall if we have a resurgence of this. Everybody just needs to be cognizant that through the summertime, this could actually come back if we relax a lot of our way of doing things, that we get back to our old norms, and we don't protect ourselves. Then there's a chance that you may have a resurgence, depending on what the medical community does as far as vaccines and all of that, what's discovered between then and now, about how all of that comes into play. That there's always still that question about whether there's really going to be herd immunity developed from people who have it or has gotten it and creating antibodies and stuff like that. That's still up in the air in the medical community and the researchers about whether that's going to be sufficient. But we still just have to be cognizant of the fact that this could come back another wave, just like the flu or anything else does, and related to these type viruses.
Okay, thanks for that response, Chief. Appreciate that. Do you have any more questions? I don't see any more here in the comment box.
I'll take any question on anything, even outside of the COVID. I'll take anything.
Well,
if we don't have any questions, I want to be sure that I tell you how much we appreciate you, Chief Carroll, and your entire department, as well as all of our first responders, our fire and our law enforcement. I know it's in your blood, obviously, that you guys rush into the danger when everybody else is rushing out. And I think our community echoes that. It's ironic you guys are doing something to show the medical professionals your appreciation of them. I guess it's not ironic. It's even more meaningful because you guys are literally the first ones on the scene showing up to respond to people that are in need. And I'm sure that has been made even more stressful with this. So we just want to make sure that you know how much we appreciate you and your department. Please convey that to all of your guys and gals at the fire department.
Well, I appreciate that, Heather, and everything. One of the things you talked about where we rush in, that's the mentality we're trying to got to change a little bit now. We can't rush in. We've got to be cautiously going in. So, and everything, especially on EMS calls at this particular point in time. But we appreciate that comment, and I'll certainly convey that to the rest of the department. Like I said, I appreciate everything they've done. They've done a great job, and I've got a good department, and they're working hard through this pandemic to deliver the professional service that we've always done.
Don't see any more questions right now. Does anyone have any comments, questions, anything else for the greater good before we cut the call off? I guess questions going once, going twice. I don't see any, so let me turn off the recording. But while we're still live, this has been recording the entire time, so you can find a replay of this or share it with anyone you'd like to. It'll be at etowachamber.org/COVID-19, along with all of our other recorded webinars, along with the upcoming webinars as well. So let me turn off the recording really quick.